how it stand in preconception period of woman.
Now, those women who are planning a pregnancy and are taking GLP analog for weight reduction, they should be careful that they should be planning, they should be having contraceptive measures to be taken for. And we are planning for pregnancy. If you are using semaglutide, you have to withdraw it at least 2 months prior to the fertility. And if you are using tirzepatide, you have to withdraw it 1 month prior to the fertility.
So, counseling in every woman who is in the reproductive age, we should counsel for pregnancy consequences as we don't have enough data for GLP-1.
You should teach your person with diabetes, women with diabetes, very important is, so they are, by the time you diagnose pregnancy, the organogenesis is already over. And if you are on the drugs like GLP-1 analog or other oral glucose lowering therapy which are contraindicated in pregnancy, these drugs will have this impact on the organogenesis of the baby.
Yeah.
And that is why there are high chances of going for teratogenicity inside.
Welcome everyone for the D-Genius podcast. I am Dr. Priyanka Rasne. Today we have a special podcast on GLP-1 in preconception period. For that we have our expertise Dr. Sunil Gupta. He is a renowned diabetologist from Nagpur and president-elect of National RSSDI this year. Welcome you sir for the podcast.
Namaste.
So sir, as you know, GLP-1 using widely in current days. We have everything: tirzepatide, semaglutide, liraglutide, diglutide. So my question is, how it stand in preconception period of woman?
Now, one should know that obesity is one of the major cause of infertility in young women.
Yes.
And unfortunately, the percentage of overall obesity and central obesity in India, more commonly versus the Caucasian, is much more higher.
Yes.
And that is why, if I say 30 to 40% of the women, sometimes even up to 50% of them, they have some kind of obesity, maybe overweight or generalized obesity. Now, when you have your BMI, which is of more than 30, or if you have a BMI of more than 27 with comorbidities, then these are the candidates for GLP-1 analog. Now, the problem is that young woman who has got obesity, who has got polycystic ovarian disease, who have got insulin resistance, and she is now recently getting married, or maybe even if not married, she is planning for pregnancy at this age along with these comorbidities like obesity, we need to reduce the weight. And if the moment you start reducing your weight, the fertility chances increases. There's better chances of having a baby, and that is why many of the women are subjected for GLP-1 analog. That's the first thing here. And many of the infertility clinics now, what they want is they want a woman to reduce weight.
Perfect. And
then come to them for fertility treatment. So in such situation, one should know that this particular drug, GLP-1 analog of any molecule, whether it is exenatide or liraglutide or the semaglutide or the tirzepatide, no drug has been tested in pregnancy yet. And that is why GLP-1 analog is contraindicated in pregnancy. That's the first message. Now, those women who are planning a pregnancy and are taking GLP analog for weight reduction, they should be careful that they should be planning, they should be having contraceptive measures to be taken for, and they should be strictly following the contraceptive norms. On GLP analog, you should not get conceived. That's one thing. When you are taking it and when you achieve the target weight loss and we are planning for pregnancy, if you are using semaglutide, you have to withdraw it at least 2 months prior to the fertility, the treatment. And if you are using tirzepatide, you have to withdraw it 1 month prior to the fertility.
Yes.
So these are two important messages. Important is that there are many unanswered questions here. One very important question, Priyanka, you should know that we are not sure once you withdraw it, in how many days you will regain the weight.
Okay.
That's one thing which no one is aware of. Second is, even when you regain the weight, how much regain will be there, how much is advisable, Whether by the time you regain weight, it should not happen, you have gone to the previous weight.
Okay. Okay. Got
You know,
it. Yeah.
for which you have used this GLP-1 law.
GLP-1.
So there are many more unanswered questions. Whether this reduction of the weight has its impact on the ovas,
Yeah.
or if it is for the male, it's sperms.
Sperms.
Even the sperm quality also matters
Matters,
in
yeah.
pregnancy. So all these questions are not still answered, and
Yeah.
that is why GLP-1 analog, if you are using it, certainly it can be used, but you should be carefully monitoring your following your contraceptive
Yeah.
measures, as well as don't forget to withdraw it before, and don't come with the accidental pregnancies.
Yeah.
GLP-1 I was
Yeah.
taking and abhi mera pregnancy ho gaya. That should not happen. That's the important message for you.
So, counseling in every woman who is in a reproductive age, we should counsel for pregnancy consequences, as we don't have enough data for GLP-1.
See, basic thing our clinicians should teach.
Yeah.
I know you all are aware of it. All the Genius group is wonderfully aware of all practical things. I
Yeah.
appreciate that. Now, you should now know what you should teach your person with diabetes, women with diabetes. Very important is 6 to 8 weeks is a period of organogenesis. By the time you diagnose pregnancy, it's already 5 to 6
5 to
weeks,
6.
or sometimes if it is irregular, even sometimes 6 to 8 weeks.
6
weeks. So by the time you diagnose pregnancy, the organogenesis is already over, and if you are on the drugs like GLP-1 analog
Yeah.
or other oral glucose lowering therapy which are contraindicated in pregnancy,
True.
or if you are on statins, or you are on antihypertensive drugs like AC inhibitors or ARBs or many other contraindicated drugs, these drugs will have its impact on the organogenesis of the baby,
Yeah.
and that is why there are high chances of going for teratogenicity in such
Right.
situation. And preconception counseling and care is utmost important. So you should be first achieving the weight, of course GLP-1 we
Yeah.
discussed. Then you should be evaluating these women for good glycemic control.
Yeah.
Again, I told you in the morning in my lecture keynote address that the periconceptional HbA1c is more important
Yeah.
than the HbA1c at the time of diagnosis of pregnancy.
Yeah.
So when you get conceived, that time HbA1c should be less than ideally 6, if not at least 6.5. For type 1 diabetes on high risk of hypoglycemia, they can target even up to 7. So you should try to achieve this 6.5 HbA1c before conception. 1.
Yeah.
Get yourself all on the safe drugs, safe
drugs.
antihypertensive, no statins, safe diabetic drugs. Insulin is the drug of choice. Next is evaluation of the vasculopathy.
True.
You have to check for the retinopathy, nephropathy, neuropathy, retinopathy, coronary artery disease. So macrovascular disease, both peripheral artery disease, everything should be well evaluated. Blood pressure,
Yes.
everything has to be well evaluated. Then you can say, once everything is achieved, then you should write as a consultant, a treating clinician, treating diabetologist, that XYZ women is fit for pregnancy. What did I say?
Fit for pregnancy.
So up till now you are giving fitness for cataract surgery,
yeah.
fitness for any other surgery.
Surgeries,
Now
yeah.
start writing fitness
For
for
a
pregnancy.
That is
Once
wonderful.
you
sir.
that's fitness for pregnancy is what the preconception counseling care aim for.
Yeah. So can we consider beyond that, it is good drug for optimization of metabolic health before conception?
Could be.
It's good drug for a metabolic optimization.
As far as GLP-1 analog, see, obesity is the genesis of is the mother of all other diseases.
Yeah,
230 plus diseases are correlated with obesity.
Yeah.
So whether it is metabolic health, hypertension, coronary artery disease, lipids, anything. Even hyperlipidemia, hypertriglyceridemia is also one of the risk factor for the babies.
Yeah.
Apart from hyperglycemia, you should also be focusing on that. So whatever amount of benefit you get with the weight loss through any measure, maybe GLP-1 will certainly have its benefit on the maternal outcome as such.
So what is your take-home message for all the physician who is writing GLP-1 in
The only thing
reproductive age?
now, young women, whenever they come of childbearing age, maybe less than 50 years of age is being called as childbearing age. Some of the data says 45 years, but then less than 50 years of any women, if you are prescribing it, first ask them, are they planning for having any conception in future? If they are not planning, then write it down there and ask them to plan to use all contraceptive measures before when you are using GLP-1 analog. That's the only important message.
Okay, thank you so much for it was a wonderful, insightful.
Namaste.
Thank you.